Hey friends, welcome to AOC PM&R podcast. I am Meghan Mardashti, one of the AOC PM&R Multimedia Committee co-chairs and your host for today's episode. For today, we have the one and only Dr. Nikola Dragojlovic with us, who has been a prior guest about 4 years ago with our lovely prior host, Dr. Shahana Momin now. And if you're in the PM&R world, you have definitely heard his talks from the AAP Road to Residency webinars. But if not, Dr. Dragojlovic is the program director at UT Houston with a passion for brain injury medicine as well as transplant rehab. And today we will be talking about navigating the unexpected and owning your own story in PM&R. We are thankfully headed in the direction where vulnerability and courage are much better celebrated in medicine. And a lot of us as medical students and residents are bound to go through those hard chapters because life happens and we might have to, or we might be knocked down our path. But that doesn't mean we have to get it or we have to fully give up. So I hope that this episode can give you the tools on how to better advocate for yourself in interviews and your residency applications. Okay, without further ado, let's jump right in. Dr. Dragojlovic, thank you so much for being here. How are you doing?
I'm good, thank you. I appreciate that lovely intro.
Of course. We would love it if you could share a little bit about your story and talk about some of the challenges that you didn't expect going into residency.
Absolutely. I was a medical student who went back to medical school after working for several years. So I'm definitely a quote unquote non-traditional applicant to medical school, right? And I was thankful and fortunate to get into NICOM on Long Island, and I had a really great educational experience there. And in OMM lab, I met Dr. Wolfgang Gilliar, who's now the dean at Toro in Nevada, and he was the one who first introduced me to physiatry and musculoskeletal care and how that blends with the neurologic system and all these other elements of medicine that I really enjoyed. That was sort of my first introduction to physiatry residency and or physiatry as a field, I should say. And going through medical school as a non-traditional applicant, I will definitely say that I had my challenges. Getting back into studying was difficult for me. It didn't come straightforward. I definitely had to spend a lot more time studying material and reviewing things than my classmates who were sort of straight out of undergrad and had their studying programs figured out. I had to learn that again for myself because it had been so many years since I was in university. And then coming into residency, I my internship was a tough one, but I came to PM&R PGY2, not knowing the physiatry lingo, right? The functional scores, the diagnoses, how patients got admitted, how they got discharged, what do you do with these things, how do you navigate complex family situations? So it was definitely a big adjustment. And it happens to almost every PM&R PGY2 that, at some point in the year, they get frustrated with, gosh, I feel like I'm still an intern, right? Where's the physiatry? And it's happening. It's just under your nose, it's under your eyes, and you don't have the language and the vernacular to understand it completely. I definitely went through that. And then going through PGY3, I definitely hit a slump where so many of my other classmates knew what they wanted to do, right? And I looked to them because they were like, oh, I want to do this, I want to pursue this fellowship. And I didn't have that figured out yet. I kind of knew what I liked and knew what I didn't, but I didn't know what path. And so we're so used to putting pressure on ourselves to, oh, this next thing is coming, then the next thing is coming, and the next thing is coming, right? And as medical students, we all know this, right? We always know what the next target is, but in residency training, you don't always have that. And so I struggled with that. I struggled with self-identification and where would I be in the physiatry space? Did I want to be in academics or private? Did I want to stay in the South where I enjoyed my training, or did I want to get back to visit family in California? And so that self-identification led to a lot of anxiety. And I struggled with anxiety for the better part of a year and a half in residency training. And during that time, I was also helping my family through some health issues that my father had. So I've definitely gone through those experiences, but came out stronger on the other side, right? I leaned on my family, I leaned on my friends and mentors. I got counseling and help for my anxiety, and that put a lot of things together for me. I was able to reframe things, and sort of see it from my own perspective, and come out with a perspective of gratitude and appreciation, but more importantly, sort of refocused on, okay, this is my career. What do I want to do? Let me go chase those things. And then when I started going after the things that I liked is when I started having fun, right? And then residency training became really fun again. And then my path sort of opened up for me into brain injury fellowship. And so it's really common, right? It doesn't just happen in undergrad. It doesn't just happen in medical school. It happens in residency too. And you have to go back to those things that ground you, whether that's families, friends, hobbies, sports. I mean, whatever it may be, you have to go back to those things. And sometimes you need the help of, medical or psychological professionals to get through that too.
Love that. Love that answer. Thank you so much for your vulnerability and also painting such a well-rounded and multifaceted picture to change because I think a lot of us tend to be change can be a scary thing because at times it can threaten our sense of self-identity, which is exactly what you described with what is it that I want to do and not having that clear sense of direction as to
Right.
we know that is a lot more clear step A to B to C these are the things you need to do in medical school but in residency it can be a bit more fluid and you kind of build your own path and mentioning the mental health aspect of it we are multifaceted beings, mind, body, spirit. And I think sometimes that kind of can be left out of conversations a lot when yes, we talk about wellness, yes, we briefly touch on it, but just going through such a big transition, adopting such a big responsibility as a resident, but also navigating other aspects of your
Yeah.
like personal life where most times than not I'm pretty sure you can't be as present as you were in the past because you're a lot busier with your resident duties. So that can definitely weigh you down. And I love, love, love that you mentioned you sought counseling because yes, we're headed in the better direction, but there's still so much fear that I've sensed from colleagues and even my friends where, oh, that shows weakness. Oh, I don't know if that looks bad, if I go seek counseling, if I go to a therapist, if I'm get on medication. So yeah, that was a very important important factor that you mentioned, and I appreciate that.
Yeah, it's just one thing I'll add. I mean,
Sure.
that's one of the unfortunate things about, medical school and, our residency training is we're always trying to quote unquote keep it together, right?
Mm,
And yes, it is important for you to take care of yourself first and
hmm.
foremost, because you can't take care of yours. If you can't take care of yourself, you can't take care of others, right? When the airplane is going down, they tell you to put your own oxygen
Yes.
mask on before you help somebody else, right? And that's medicine, right? You need to take care of yourself so that you can take care of other people, right? So you have the mental awareness and the mental flexibility and the ability to manage relationships and the situations around you to the 110% best of your abilities, right?
Hmm.
Because the other thing I think that happens a lot in physiatry that we don't always think about is that our patients look to us as examples, right?
Mm,
Examples of someone who's doing exercise to stay healthy, right? Examples of someone who's navigating a difficult workplace, right? Examples of someone who can be open and understanding in difficult times. And so we have to try to set that example for others, not just do it for ourselves so that we can take good care of patients, but so that family members and others can see it in us too. And, you know, sort of unconsciously see how we can help them and each other as they go
hmm.
out into the world after their doctor's appointments or inpatient stays or whatever it may be.
Hmm. Absolutely. You can't pour from an empty cup. That's one of my
Right?
favorite sayings of all time. And I think thinking about it like that as well, that our patients are looking at us as an example, can almost give you more self-compassion that, hey, if I've gone through these hard things, yes, it was tough, but at the same time, it allows me to not only better connect to my patients, but something that I can use as a lesson that, hey, look, I was able to go through this hard thing because human emotions inherently aren't different. Yes, our experiences might be different, but the emotional experience that our patient in front of us is going through is something as well, in my case, future physiatrist, you can connect to. And that's so, so important to keep in mind. So,
I
another
agree.
wonderful point.
Anytime, agree. Anytime you can, reflect upon your positive experiences to show compassion and understanding with the people in front of you, that's always going to make you a better physician.
Hmm. Amen. Amen. So talking about struggles and at your position as a program director, what do you think are some of the common struggles that, or most common struggles in your experience that residents have faced? And is there any way that applicants can possibly prepare themselves for it emotionally and, I guess mentally, or is that more of a life experience and you just have to go through the course of life?
I mean, I think it's a combination of those things, right? So I
Mm-hmm.
do think that, struggling in medical school is much more common, as you alluded to.
Mm-hmm.
Whether that is related to academic performance or rather, not sticking around in hobbies or things that you enjoy, being disconnected from family, like geographically, physically, emotionally, whatever it may be, right? These are trying times in
Mm-hmm.
people's lives when you're undertaking such a large magnitude of study like medicine is. And then, all of those same challenges transition to residency too, right? People fly across the country for residency. Maybe they didn't get into the program that they wanted. And so their expectations of how they thought they would do and what came out of the match was not the same. Um, we love in medicine to beat ourselves up for things that didn't go right, quote unquote. And we can't control everything. And so being able to give up control is tough. And accepting the things that have come before you, like maybe you didn't match your number one, but you matched your number three, right? In the big scheme of things, that is a huge accomplishment, and you're going to get great training where you go. But being able to accept that and welcome those challenges, it takes time.
Mm-hmm.
But residents run into the same things that medical students do too, right? Maybe they didn't do as well on rotations as they thought. Or maybe they didn't get the letter of recommendation or the research project that they thought they could because they're applying to a really competitive fellowship, right? The
Mm-hmm.
challenges never stop, right? And we put a lot of expectations on ourselves to perform at an extremely high level, academically taking care of our patients in our applications, our research, whatever the next step is, we're always chasing that next goal, that next target. And so not living up to those expectations that you set for yourself is a challenge. And
Mm-hmm.
medicine in 2025 is an inherently a difficult place to be, right? It's very emotionally charged, especially in physiatry. There's a lot of patient care needs. There's a lot of family care needs that appear during the course of a patient's care that we have to tend to as well. And that can be challenging, not just from a time perspective, right? Our patient's care often requires a lot of time, but it can also be, emotionally exhausting or physically exhausting, and being able to keep up with the demands of the residency is a challenge for many residents. They often like, oh, if I just get through this block of inpatient months, I'll be better
Mm-hmm.
in outpatient clinic. And that's not always the answer, right? Like, yes, you can get through your inpatient months, but if you haven't been exercising and taking care of your sleep and nutrition, there's no way that that outpatient month is going to be better, right? Um, and life happens to residents too, right? People get married, families get sick, right? You want to take an impromptu trip somewhere. You get a flat tire and you have to spend $300 getting a new tire that you didn't budget for. I mean, these are things that happen in life, right? And I think that the most important thing that we can do for ourselves, wherever we are in our training, is to remember that life happens, and we have to give ourselves the grace and the flexibility to let those things happen, right? So that we can
Mm-hmm.
just be ourselves and not be so focused on all the minutia that are in front of us.
Mm-hmm. Mm-hmm.
But then for residency applicants, right? Um, how do you take that story of a struggle and transform it, which I think is
Yeah.
kind of where we were going with this
Yeah.
topic. Um, I think it's very important to not focus on the like extremely fine minutia of what happened, right? I do think that it is important to tell the story. I think that it is important to be honest in the story. But I also think that, especially in physiatry, we love an underdog, right? We love a comeback story in physiatry, right? That's the heart of what we do. And so I think as an applicant to physiatry who has, maybe struggled with academic performance, or you had to take extra time, or, maybe your clerkship grades are not as strong as you wanted them to be. Your COMLEX scores or USMLE scores are not as good as you want them to be. Or maybe you had a failure, something. You need to acknowledge what those things are, but it's more important to tell the story of how you turn that around, right?
Hmm.
Because as a program director, we have 16 residents in our residency program. They go through ups and downs, right? We're there to help them find the solutions and put those solutions into place. For you as an applicant to residency, I want to see that you had the ability to find those solutions. And I want to see that you put those solutions into place so that when the inevitable things come up in residency, you're ready to tackle them again, right? It's not so important what happened as your response to what happened, right? And how you're going to be a better person coming through the other side of that chain of events.
Mm. Wow. I just want to take a pause moment here. And if you could repeat that last part, that there was lots of golden nuggets packed in there. If you could repeat that, that was beautiful.
Sure. So as an applicant to residency, whether that's physiatry or any other specialty, right? Like there's going to be things on your application that you don't love, right? And if you have a
Mm,
quote unquote red flag, it's not the flag doesn't matter as much as how you acknowledge it and
mhm.
tell the truth about it, but then also how you demonstrate your response to that thing, because how you came through on the other side and how
Yep,
that made you a better person and how that will better prepare you for your future career in medicine, that matters most.
yep,
We're looking
yep.
for that because that shows maturity, that shows professional development. And those are all things you're going to need to continue to cultivate, not only in residency, but in fellowship and your medical career for the decades to come.
Hmm. Yes. Um, I think a lot of times we are so paralyzed by that fear of failure, but also fear of, because that creates a sense of rejection when we have those red flags on our applications that, man, like this is the path that I had in mind. This is how I saw it going. And then this thing happened where it kind of knocked me off course a little bit. But that doesn't mean the path can't be continued still. It's just
Right.
you need to take like a different alley, like make an extra turn, take this exit, and you can
Mhm.
still get to the destination. And response versus reaction, that is so, so important because it is the anxiety, the stress that comes with those red flags, whether it's an exam failure, whether you had to take an academic extension for some family or health things that came up can be so crippling. But were you able to find solution in that time of high stress because it can be translated into, let's say you have a code blue happening or something just as, I guess, emotionally taxing and happens in residency, can you respond to that? So I really like that almost parallel of like this is how you respond to it can be translated into how type of future resident you can be. And I hope our listeners can take that from this that um, it's okay for us to go through hard things. It is
Right.
very much so normal. And I think like if we're able to show that growth in our application by appropriately advocating for ourselves, which also I would be interested to hear how you recommend applicants do it. Because it could be the other side of, oh, am I talking about this too much versus is this a good balance? But the other side of, I don't want people to see me as broken.
Right.
Um, so yeah, I'd be interested to hear your thoughts on that actually.
Yeah, I'm glad you sort of came back to that, right? The story of or the idea that, the event that happened is not the end of the story, right?
Mm,
It's a part of it, but it's not what defines you, right?
right.
And it's not the only thing to focus on.
Hmm.
Um, and so, you know, the path that we're taking in medical school and residency training and being a future physician, we are committing ourselves to being uncomfortable for many, many years to come. It's not going to stop when you're, in practice or a faculty member. You're going to continue to have uncomfortable situations. how you respond to those uncomfortable situations is how you will define yourself and how people will see you, right? Did you make good out of a bad situation? Did you demonstrate calm and leadership when people around you were scared or fearful, right? They will look to you as the physician to do that. And by demonstrating emotional maturity in your medical training as a student and responding to those challenges in a way that's growth mindset oriented, that's literally demonstrating how you will do so in the future as a physician,
Mm-hmm.
right? When I was in fellowship, I remember taking care of, really challenging, devastatingly neurologically injured patients. And one of my mentors, Dr. Sunil Katari from Baylor College of Medicine, I just asked him, I was like, Dr. Katari, how do you how do you reconcile just leaving the hospital being uncomfortable about what's going to happen overnight or the next day? And he kind of smirked. And Sunil is not someone who is like particularly like affectionate or
Oh.
demonstrates his emotions as much like I do. But I remember he put his hand on my shoulder and he said, you just sort of learn to be comfortable with being uncomfortable. And that was a big lesson for me because to this day there's always times where I leave a situation feeling a little uneasy, but I know I'll come back to it, right? I know I'll give my best. I can lean on the people around me to help me. And so I think that's really important to think about as you move through your applications.
Mm-hmm.
Now, how do you do that, right? Because you don't want that, whether that's a step failure or having to redo your third year of medical school or something. You don't want that to be the only thing that you focus on in your application, right? So one place to do it is, acknowledge a challenge like that in your personal statement, right? But if you're going to write about it in your personal statement, again, you need to come back to the idea of how did you grow from it? How did you change? And how is that going to prepare you for the future? How are you going to be a better physician because of that, right? Again, it doesn't matter so much what happened, but your response to it. So I think the personal statement for some people is a great place to acknowledge it. On the AAMC ERAS application, you also have a place for extenuating circumstances, right? So say you had to take a gap year because you were caring for someone in your family who was really sick. That's a place for you to talk about why you took that year off to sort of explain, right? No one is going to fault you for something that happened to your family member that was not out of your control. But program directors want to know, like, hey, what happened during that year? And it's not because we're judging you. We just want to make sure that you weren't like vacationing in the West Indies for a whole year, and that like there was a real reason for what happened, right? When there always is. But the AAMC ERAS application has places for you to address that, either in the short statement of the extenuating circumstances that you get there. Some people like to develop that a little bit more in the personal statement. But I think the important thing is to not focus on it in like three or four different places, right? Because yes, you want to clarify, yes, you want to explain, but if you put it in every possible place, people are going to wonder why you're harping on it so much. And that takes away from your ability to shine in other places, right?
Mm-hmm.
Because what if you worked for a national organization or you like sponsored a fundraiser 5K for new sports equipment at a gym in your local area, right? That's so cool. And if you spend so much time focusing on the quote unquote bad thing that happened, you lose space for you to shine over here, right? And
Mm-hmm.
so you want to acknowledge those things, you want to show the response, but you don't want to dwell on it because there's obviously other places of your application that you're going to want to highlight too, so that people can get the best understanding of who you are, what you're after, and where you're ultimately going.
Mm-hmm. Yeah, absolutely. So it almost sounds that you can categorize it into this is what happened, here is what I learned, and how I can, let's say, contribute to your residency program to make it more into a life lesson rather than just this was a red flag. I mean, it is in a sense, it's still a red flag, but then transitioning it into more of, or explaining it with more of a growth mindset and
Right.
valuable life lesson,
Right.
would you say?
Right.
Okay.
Because it's not going to be the last time something challenging happens to you, right?
Mm-hmm.
I mean, that's just not the case, right? Everyone
Right.
goes through residency and has a challenge of some kind, whether that's personal, whether that's family related, whether that's with a significant other, right? Like there's always going to be something that happens and that's life.
Mm-hmm.
But again, the maturity to take stock of what's going on and respond. How do you move forward and how do you make the best of it? Um, Understanding that and seeing that growth in the person matters so much more than the red flag itself.
Mm-hmm. Absolutely love it. I did want to go back to one thing you mentioned earlier on with residents in residency, how it turns into the chase of next rotation will be better. Once I'm done with this inpatient month, what would you say? I guess how can you make that mindset shift to not chase the next thing, um, and I guess be able to focus more on enjoying the journey while the journey can be very, very stressful at times.
Yeah. Yeah. That's $1 million question, Megan. I mean, that's a
Yeah.
challenge for all of us, right?
Right.
Um, I have a 6-year-old and a 4-year-old at home, and they're
Mm-hmm.
a lot to handle. And every single
Oh,
time I talk to parents with older children, they're like, "Oh, I love those years. Like you really need to enjoy that time." And I'm like, "Oh man, I'm lucky if I can get my kid out the door on time, right? I don't want him to be tardy for his first grade classes." And how do you not get like frustrated and overwhelmed at those times? Because like 6-year-olds, they're not particularly good at listening.
yeah.
So, like the challenges are always going to be there, right?
Hmm.
And, we live in a world that's extremely fast paced. Our news cycle is like 20 minutes long now, tops. And, if you're not taking time to slow down through your day-to-day work as a resident, that's where you run into trouble, right? It's really important to take a break for a good meal, take a minute to decompress with the staff between a tough patient situation, right? If you know you haven't exercised in a few days and that bothers you, you should go exercise rather than trying to study. Because if the whole time you're trying to study and all you can think about is how you wish you were running, you should just go run instead, right? Like
Yep.
you need to,
I feel personally attacked. I've been there
no,
for
not at
sure.
all. No,
I'm
but
just
what I
kidding.
what I mean is
Yeah.
like you need to make time for yourself. You need to slow down, right? And that's the
Mm-hmm.
basics. Sleep, hydration, nutrition, right? Looking after your not only personal health, but looking after the health of your relationships, staying in contact with friends and family, doing things that you love, because being a resident is not what defines you, right? You are a person in a residency program.
Mm-hmm.
You're not a PM&R resident going into pain, right? You are a person with, you know, particular joys and hobbies and passions. And when you try to slow down, it helps you be yourself. But you have to be intentional about it, right? The
Mm-hmm.
entire medical construct in 2025 is created around speed and efficiency. So you have to try to run almost opposite of that current to be your
Mm-hmm.
best self, right? Yes, the clinic is going to want you to go like this, but at the same time, you need to try to slow those snaps down, right?
Right.
You can't slow everything down. So you have to pick and choose what you slow down, right? And that takes time and that takes some reflection and that takes some experience, right? Um, but you find your way.
Mm-hmm.
But then you can also have mentors and other people who care for you. You check in with them, they check in on you. And those are the types of things that you'll find more often than not will be the sort of fertile ground for beautiful relationships in the future.
Mm-hmm. Yes. Um, if anyone's watching this virtually, I'm looking like a bobblehead, just nodding my head left and right here. But it's because it's so true. I'm really grateful you shared those more tangible tools as to what we can do with exercise, nutrition, checking in with yourself, giving yourself the space to be present with your thoughts. And it could be as simple as just eating your meal. Hopefully, you can make 2, 3 minutes outside away from the computer as you're doing notes.
Yeah, yeah.
Um,
The
and
eating in front of the chart is like the worst thing you could do for yourself,
yeah.
right? Just like go find a space and sit
Yeah.
and eat, right? But then also
Right.
don't doom scroll
Oh,
forever
yeah.
while you're eating, right? That's also the worst thing, right? Like slow down
Yes.
and enjoy the food.
Yep.
If someone comes by and they see you looking at your phone, they're probably not going to say hi. But if
Yeah.
you're like chilling with like facing the door and you're eating or you're like reading or
Mm-hmm.
something, people are going to be more apt to come by and say hello to you, right? If they see you so
Exactly.
locked in with your phone and your food that you're hunched over, that's not
Yep.
approachable. It's just not.
Yup. Exactly. Yeah, we need that cognitive rest. We need genuine social connections to feel rested. And that can help us a lot with hopefully preventing burnout or
Mhm.
just more longevity and enjoying our training a lot better. And I think self-awareness and being conscious of medicine is genuinely a fast pace. And I've definitely fallen in the thought pattern that, oh, it'll just get better because you hear it's like, oh, as you progress in your medical education, you learn more, you know more. Yeah, you get busier, but it'll get better. So it's almost easy to at times become passive and be like, oh, I'll get stronger or I'll know more. I know how to handle more patients, but you still need to be conscious. You still need to prioritize yourself because if you don't, medicine, like you said, is a very fast-paced
Mhm.
environment. It can just like sucks you. Oh, or no, I guess no, that can be that's a little dark if I'm like sucks the
No, I
living
get
life
what you're
out of you,
saying.
but
I mean, look, let's be honest.
yeah.
It happens to physicians and medical students all the time that they lose themselves in their
Yeah.
career trajectory, right? It happens
Yeah.
all the time.
Mm-hmm.
So, like as a medical student, everyone's like, oh, don't worry, like your notes will get better as you practice. Yes, after writing 300 notes, your notes should be better, right? But
Right.
you need to get check-ins from people to tell you if your notes are getting better and if they're not getting better, what you can do to make them better, right? Just
Yeah.
writing 300 notes doesn't make you better at them. Maybe you'll get faster at them, but if the content is
Mm-hmm.
all wrong from the beginning and you're not steered in the right direction, then your notes are still going to have bad content at the end of 300, right?
True.
And so this is the point of that whole like stopping and reflecting and checking in and getting mid-rotation feedback or like stopping with your faculty member at the end of your first week of your away rotation. Like, hey, I felt like this week I was really good at helping you, get patients in and out of the room, but I struggled with writing too much in the notes. Can we look at one of my notes and show me what was important here and what's not as important, right?
Mm-hmm.
That 5 minutes is going to be such a huge growth opportunity. And then you demonstrate to the faculty member your level of investment and not only performing well on the rotation, but how you're going to be in the future as a resident, right?
Mm-hmm.
But you did
Mm-hmm.
the right thing because you stopped and checked in. You didn't just like work, 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 right? Like work, stop, reflect, work, stop,
Right.
reflect, right? And 2025 is a time where we have so little time for reflection. So we really have
Mm-hmm.
to be intentional about making time for it.
Mm-hmm. I think for medical students, or honestly, even residents who are listening, just having that intention going into every rotation, maybe like a reminder on your phone to it could be like a hey, making sure that I do a mid rotation feedback, but
Mhm.
also using that not just to get feedbacks on your notes, but also doing a self check-ins like how am I doing? How am I feeling? So it can be more of that like multifaceted check-in for both self growth, but also improving on your clinical skills or note writing. Um, yeah, that's a pretty good way to go about it and hopefully allows you time to kind of swim against the fast-paced nature of medicine. Um, we've talked a good amount about lessons, things that can, be challenging in residency and also tangible tools on how you can advocate for yourself, but also ways that you can be a bit improve on your self-awareness during your rotation. Um, so there has been definitely a lot of advice packed throughout the episode so far, but as we're wrapping up, what would you say is one piece of advice that you wish every applicant would know before starting residency?
Oh man. Um, I
No
would
pressure.
say there's nothing that you can study between the start of medical school graduation and your start of internship that will better prepare you for internship. But what you
Mm,
can do is you can go on that trip. You can go visit your family. You can go put your toes in the sand somewhere, or you can go try new foods, right? You can do that 100-mile bike ride you were planning, right? You can like go on that tour of like barbecue places that you wanted to do before you leave, um, where you went to medical school. You just think about those experiences that you sort of wanted to like check off or had been wanting to do for a little while, like before internship, and try to do as many of them as you can. Um, Internship is inherently a really hard time. You're very busy. You will take call. You will have nights. You will be working in complicated healthcare environments that are emotionally charged, right? And there's nothing you can study to make that better, right?
mm,
But you can get yourself sort of emotionally ready by looking those things that maybe you put off, right? It's extremely common for us in medical school to delay gratification because we're so busy doing things. Well, completing all of medical school and having like a month or two break before July 1st is a really good time to do those things that you put off, right? Like you wanted to go surfing in California, go. You wanted to go on that restaurant tour, go. You wanted to like make that trip with your significant other, go, right? Whatever it is that makes you happy, just do that thing. And
mm,
then make sure in internship you find ways to do some of those things too. And you just
mm-hmm.
don't get lost in the,
Go, go,
busyness
go.
of the internship of go, go, go. Like, yes,
Mm,
internship is a lot of go, 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 but you're going to have to find ways to slow down. Uh,
yeah.
but if you can get some of those great times under your belt, then you'll enter internship with your glass full again, right? And you don't have to worry
Mm-hmm.
about pouring from an empty cup.
Yes. Amen. Oh, love that. Um, yes, we need to know what are the activities that help recharge us, calm us down, help ease our nerves. And if you haven't experienced or explored what that looks like for you, then when things get even more difficult in interning and in residency, then how would you know?
Right.
So I love that, making sure you're reconnecting with your hobbies and allowing yourself time before July 1st to reconnect with nature and find what it is that gives you genuine joy.
Exactly.
Yeah,
Exactly. And do those
awesome.
things, right? And
And
then
do
don't
those
forget to
things.
do those things as an intern or as a resident or as a fellow or whatever.
Yeah. Yeah, we got to make time. We got to make time for the things that matter to us, for
Yeah.
sure.
Because no one's going to make it for you.
Mm-hmm.
Right? And it's not like the medical care environment was like, hey, Dr. D, I've seen that you've worked really hard for like the last 2 weeks. Why don't you take like 1 hour off so that you can go enjoy a lunch with your friend? I mean, the hospital's not going to do that for me. Okay. Like I
Yeah,
have to do it for myself.
right.
And this just goes back to the whole idea of,
Mm-hmm.
looking after yourself and taking
Yeah.
time to slow down when you can. And enjoying those times that are slow,
Mm-hmm.
and not constantly chasing the next thing, the next thing, the next thing.
Exactly. Well, hopefully, this episode gave our listeners a good reality check of, taking the time and appreciate the small things, smelling flowers,
Mhm.
touching the sand with your toes, and doing the things that fill your cup. And I want to thank you guys all for being here and being part of this conversation. I hope you found it as helpful as I did. And if you guys have a few seconds, it would be amazing to leave us a review on Spotify or Apple Podcast page, and let us know what you guys would like to learn about in the future. Thank you so much, guys, for being here. And thank you, Dr. Dragojlovic, for spending your time with us. It was amazing having you here.
I really enjoyed it, and I'm thankful to you and all of your colleagues for putting these podcasts together, making them accessible for medical students interested in physiatry, and not giving up on these tough conversations that are so important for us to have.
Awesome. Well, thank you, guys. Until next time.